Good evening, ladies and gentlemen. My name is John. I'm going to be your host for this evening's webinar. Tonight, we actually have the pleasure of having Dr. Kohli, who is a nationally and internationally recognized leader in the field of urogynecology and reconstructive pelvic surgery. He leads the team at Boston Urogyne in Wesley, Massachusetts. When Dr. Kohli is not doing his day job, he usually can be found authoring many scientific articles, book chapters, research abstracts, clinical presentations, and multi-educational tools. In fact, Dr. Kohli has actually authored more than 100 scientific articles to date. His current interests include minimally invasive pelvic surgery and advanced technologies for the treatment of prolapse, incontinence, and pelvic pain. Dr. Kohli also teaches students, residents, and fellows within the Harvard Medical School system and medical colleagues nationwide. A few housekeeping items before we get started this evening. Dr. Kohli is going to present for roughly half an hour. At that time, or at the conclusion of the 30 minutes, if you have any questions, feel free to enter the questions into the chat box in your GoToMeeting window. Dr. Kohli will then answer all questions in the order that they are received. So with that said, I'd like to invite Dr. Kohli. Dr. Kohli?
John, thank you very, very much. I'd like to thank all of you for taking time out of your busy schedule, especially during the holiday season. I hope this is going to be both an educational and enjoyable session. And I'd like to thank BTL for giving me the opportunity to share my experiences with you regarding the Emsella chair. Just as a brief introduction, I did a training program as an OBGYN resident, and then I did my fellowship with Mickey Karam in Cincinnati, during which time my real interest was advanced therapies and new therapies for pelvic floor dysfunction. I then returned back to Boston where I grew up, did my executive MBA program at Kellogg, and then served as the chief of urogynecology at the Brigham and Women's Hospital for about 10 years before going into private practice. And during that time, I've had the pleasure and privilege to train at least 10 to 15 fellows, a variety of different residents, and really work on new therapies for pelvic floor. I was very interested in the minimally invasive slings that came out, in some of the mesh use, neuromodulation. And over the last 2 years, I've really spent a lot of time looking at, from a scientific as well as a clinical and a business standpoint, the use of some of these advanced therapies. And we are going to talk mostly about the BTL Emsella chair today, but in our office, we have a CO2 fractional laser that we use for pelvic floor dysfunction. We have 2 separate radiofrequency therapies that we use, and we also use PRP quite aggressively for a variety of different pelvic floor conditions. And I'll talk a little bit about where this chair may fit into those other advanced therapies as well, because many of you may actually have some of those therapies already in place. And the question becomes is, where does this fit in for my patients? So just as an introduction, my focus really is pelvic floor. And as a urogynecologist, we traditionally focus on incontinence, overactive bladder, and prolapse as kind of being the big 3 that we see in terms of our patient population. And that ranges from young women in their 20s to older patients above 90. Incontinence affects over 25 to 50% of women, and 10 to 15% of all women will undergo treatment for prolapse. It's the most common reason a woman gets admitted to the nursing home, and these numbers are probably vastly underestimated, as this is a condition that most patients don't like to talk about and most physicians don't ask. Given the evolution of treatment options, which has happened over the last 10 to 15 years, we're still looking for better options. And I think in terms of stress incontinence, the sling procedure is a wonderful procedure, although there's kind of been a dark cloud over the slings and meshes for pelvic prolapse. And a lot of patients are looking for alternative treatment options, which are a little bit more holistic, potentially safer, and more easily done in the office setting without the risks of anesthesia or surgical complications. One of the trends we've seen in the last 2 to 3 years is a new focus on GSM, which is genital urinary syndrome of menopause, where we're realizing that postmenopausal women have many, many different components of pelvic floor dysfunction, including vaginal pain, dyspareunia, overactive bladder, recurrent UTIs. And we're starting to learn that the traditional anticholinergic medications for postmenopausal women who already are suffering from vaginal dryness only makes that symptom worse. We're also looking at vaginal laxity in both young and older patients, fecal incontinence, and then for us, for the last year, we've realized a lot on pelvic pain, pudendal neuralgia, interstitial cystitis, and associated dyspareunia. So we're seeing a trend of expanding what our attention is in terms of the pelvic floor, going from traditional incontinence, overactive bladder, and prolapse to a variety of different conditions. And I think this is a nice way for all of you to start focusing and creating niches or specialty clinics or services as you approach your patients. The external factors are pushing minimally invasive procedures that are safe and effective. We're looking for both, and ideally office-based. That these are attractive therapeutic options for both patients and physicians alike. I think one of the things that we have underestimated over the last 20 to 25 years is the importance of pelvic floor strengthening. When I went to the Brigham, here's the Brigham and Women's Hospital, we do 12,000 deliveries a year. I joined them to create the division of urogynecology. They didn't have one female pelvic floor physical therapist. And I thought that was fascinating and frustrating at the same time. And now when I left the Brigham, which was about 8 years ago, I'm in private practice now, they had 10. So I think the importance of pelvic floor physical therapy and pelvic floor strengthening cannot be underestimated. I had the privilege of going to the ISHWICH meeting about a month ago, the International Society for Sexual Women's Health. And pretty much every lecture we had during the course of 3 days had a component of pelvic floor physical therapy. And I think that if you don't have access to a pelvic floor physical therapist, you definitely need to get one. And once you start seeing the contribution they make to your therapeutic treatment options, you'll just expand those indications. It's advocated by the Agency for Healthcare Policy and Research, ACOG, and AUA as first-line therapy for most pelvic floor conditions. And there's a growing awareness and value of pelvic floor PT, not only as a primary, but an adjunctive therapy. The real challenge for pelvic floor PT, though, in our area, at least in Massachusetts and New England, has been that access is difficult. There are clearly not enough pelvic floor PTs to address the needs of patients. Quality is inconsistent, and cost is an issue. Medicare keeps reducing reimbursements for pelvic floor PT, and so you're finding, at least in the New England area, there's two groups of PTs. Those that are affiliated with a hospital who don't have any clue about the finances, don't have any clue about efficiencies, and it's very hard to get in to see them, but they take almost all insurances, most likely at a loss to their department. And then the second group of PTs are those who are financially responsible or at least knowledgeable. And many of them have dropped many insurances, especially Medicare, and they're charging anywhere from $250 to $300 an hour. Now, many of these physical therapists, they will do education for about half of that visit, and then they do pelvic floor assessment and strengthening for the other half. And right now, we're finding a large unmet need between pelvic floor exercises and invasive therapies, which pelvic floor PT will often fill. But again, access, quality, and cost continue to remain challenges. So when we were approached with the Emsella electromagnetic chair, and we've had the chair since February of this year, we've done approximately 70 patients to date, and I'll share with you my experience on those patients. And so many of you may approach this as a very new technology, but it may be surprising to realize that there are over 100 papers, abstracts that have been published and presented for a variety of different pelvic floor conditions in both males and females over those 20 years. So when your colleagues or your patients are saying, well, this looks new, is there any data? We do have data, and that data was used as a predicate device when Emsella got FDA clearance for the stress incontinence in terms of efficacy and safety. So we have data, but we've got a better mousetrap. And compared to physical therapy, it's much more comfortable, it's convenient, it's comprehensive. We have not seen any significant complications, and ultimately, and in the future, there'll be the ability to customize it. So I want to spend a few minutes on those benefits relative to physical therapy. We send a lot of patients to physical therapy. We actually have approximately 10 to 15 PTs around New England who we refer to very frequently, only because of the volume of patients that we see and the value that we put on pelvic floor PT, either as a primary treatment, as an adjunct treatment, or a post-surgical treatment. Having said that, many of our patients come back and they say, I had to undress. They put a probe in my vagina, fingers in my vagina. It wasn't very convenient. I had to wait long time. It was hard for me to find the right person. I had bladder infections, or I had a vaginal infection as a result of it. And the Emsella chair is in many ways a revolutionary approach to pelvic floor strengthening. Now, I don't like to call it pelvic floor PT because I do think that our PTs provide a very valuable service in terms of education, instruction, and biofeedback. But in terms of actual pelvic floor strengthening, I think the Emsella chair does a much better job in terms of being very consistent, being very comprehensive, and being very comfortable for patients. And we'll talk a little bit about that. For those of you who don't know how the chair works or who haven't been exposed to it, it's essentially as simple as coming into a room, sitting on a chair, getting into the right position, and then starting the program. The patient doesn't have to undress. They don't have to wait. They have a very consistent experience where they're getting strengthening the floor. And the customizability of this is the thing that's most exciting to me. So currently, it's using high frequency and low frequency technology for both slow twitch and fast twitch fibers, so that it can address overactive bladder types of conditions as well as stress incontinence conditions. But over time, there's the ability to actually customize the program so that you might be using it for myofascial release, you may be using it for relaxing techniques, you may be using it for different conditions, similar to a Stairmaster, where you could actually program whether you want endurance, whether you want aerobic, or whether you want strengthening. And so I think that's something that's going to be exciting coming down the pipeline. Now, with the chair, the software updates would be rolled to the chair, the programs would be available. So we're working with physical therapists around the country, as well as in Europe, to try to create customized programs. And we're also looking to our providers and our clinicians to also give feedback into that. So I see in the future the ability to actually put customizable programs for different conditions, different age groups, that could be much more specific and sensitive to the symptoms that your patients might have. So the importance of the pelvic muscle complex, we've realized that it's not only a question of laxity and prolapse, but it is important in fecal incontinence, it's important in pelvic pain, it's important in overactive bladder, and it's important in sexual dysfunction. What's really important is our understanding of the pelvic floor and the ability for patients and physical therapists to only exercise certain muscles because they can only reach or feel those muscles. And the Emsella chair creates a magnetic field in the center of the seat, which actually encompasses all of the muscles and therefore gives a very comprehensive and consistent stimulation to the muscles. And as a result, we see lots of patients that can't respond well to physical therapy because they can't recruit the right muscles, whereas the magnetic field and the magnetic chair can do that. And we have many patients who actually tell us that, oh, by the way, my hip is feeling better, or I had other issues, then those are feeling better. And that's because you're creating a global tightening and strengthening of the pelvic muscle complex, as opposed to specific muscles that you can only restrict yourself to because you can feel or touch those muscles. So how does it work? Fascinating. It's basically Faraday's rule of electromagnetic induction, where it creates a magnetic field and subsequently will actually cause the pelvic muscles to contract. And you can actually see during the contraction, during the stimulation, that the pelvic muscles before stimulation are weak and saggy. And with the electromagnetic intervention, you actually get tightening of the muscles. Amazingly, it actually causes 11,000 contractions in 28 minutes. And again, that speaks to the consistency and the comprehensiveness of the therapy. I usually tell my patients that with a physical therapy visit, half of it being education, half of it being strengthening, you're probably getting, if you're lucky, anywhere between 40 and 60 contractions during that time. And many patients physically just can't maintain that without fatigue or boredom. The fact that they can sit in a chair comfortably, read a magazine, and have these 11,000 contractions on a consistent basis is remarkable. And again, it also contracts those ancillary muscles. And they've actually shown ultrasounds where they've seen the relaxed and loosened pelvic floor, and after doing the Emsella chair, they've seen a tightened floor in terms of the elevation of the pelvic floor musculature. So how does HiFEM work? Again, according to Faraday's law of electromagnetic conduction, the electromagnetic field creates a electrical energy source, which then causes an action potential with depolarization and repolarization of the muscles on a comprehensive basis. So any muscles that are in the magnetic field will actually undergo contraction. By changing the frequency of the electromagnetic field, we can actually create slow twitch or high twitch, or we can actually increase the duration of the muscular contraction. So we have a lot of opportunity to customize the programs moving forward. And this is really the big difference. In the common exercise with Kegel exercises, patients have a limited ability to recruit in terms of the number of muscles, the muscle groups, as well as the sustainability and the maximum contraction of those muscles. Whereas with HiFEM, we can specifically target the neuromuscular tissue, causing rapid depolarization of the neurons and resulting in concentric and consistent contractions of the muscle, stimulating the entire pelvic floor area. And this is basically pelvic floor physical therapy on steroids. It's much more efficient, it's much more effective. So I think a therapy is great. I went to a marketing school and they say that the technology is excellent, but if you can't get the word out and if people don't know about it, what good is it? And I think one of the things we're starting to realize is that pelvic floor exercises for all as a holistic and comprehensive approach is a no-lose situation. I don't think you can ever harm a patient by doing pelvic floor exercises and pelvic floor strengthening, and it has a global benefit to the patient beyond the disease process that they're coming into. So we have many patients that we do pelvic floor physical therapy or exercises for who say that in addition to their stress incontinence getting better, their sexual function is better, their pelvic pain is better, so they have a variety of different benefits. So we're strong believers floor exercises and strengthening as a adjunctive therapy for almost any disease process and for any treatment that we offer our patients. In terms of office exposure, we basically want to offer patients the most advanced cutting edge technologies we can. And we also realize that some patients will go a strictly insurance route. Some patients will want to look at advanced therapies, but we have a variety of different displays in our office telling them about the technology. We have a video that runs in our waiting area that tells about the different technologies. And many patients will actually see these things and actually bring them up during the course of our discussion before we even get to it. We've really approached it as a high product. This is the room that we have where our Emsella is. We've tried to make it as comfortable and as spa-like as possible. We have a little stand you can see in front of the chair. There's a magazine rack. People can bring their computers. They can bring a book. Now, you can't keep any electronic in your lap, and you want to keep it outside of the field. And therefore, we've got a little mobile table there. So a lot of our patients bring their computer or laptop or tablet, and they'll do work on it while they're sitting there comfortably getting the treatment. We've got the TV in that room, which we show a video. We show patient testimonials, but we make it a very comfortable room. Now, what's really interesting strategically, and some of you can do this and some of you can't, when you come to our reception area at the end of the hallway, this is the room that you hit first. So it's the first room you see or get to when you're entering our clinical suite, and it's the last room you get to when you're getting back to the reception area. So what's interesting about that is that the machine makes a clicking noise, which is very characteristic and kind of unique. So patients in our reception area can actually hear the clicking noise, and many of them ask, what was that? So it's a nice way to start the discussion about it. The other thing that I find, and we talk a little bit about kind of try it, you'll like it, when I talk to patients about the machine, trying really is believing. So as I walk them back to the reception area or the front desk to schedule their appointments, I always ask them, would you like to just try the chair? And I would say the vast majority say, sure, I'll sit on it. And so our machine is always on. And what we do is we have them sit on it and we turn it on. We have them positioned. We change the intensity a little bit. And they literally try it for about 5 minutes. And I will tell you that I think our conversion rate, if you sit on that chair, is about 80%, because they can actually feel the contractions. And so it's a nice place to put it. We don't put it at the end of the hallway. We've really got it in a very focal spot in terms of our practice. One of my favorite stories is that Mother's Day this year, my mom is 72, and she said that, I'm starting to have some urinary incontinence. And I said, well, Mom, you're talking to the right person. That's what I do. And we have this interesting chair. And so this was shortly after we got it. And one of the reasons I'm on the line with you tonight, and one of the reasons I'm enthusiastic about the therapy, is that my mom actually sat on this chair for 4 weeks, and her incontinence is cured. And so I felt that nobody would be more critical about a technology that I was going to offer other patients than my own mom. And every week I talk to her, I always ask her, how's the incontinence going? And she's still, 6 months later, doing great. So in our practice, this is mom tested and mom approved. We have found that it's such a unique technology that we're getting referrals from urology and gynecology. We're getting referrals from PTs. And I think it's important that we really positioned it as not a threat to physical therapists. We talk to them about the value they bring to patient treatments, including education, accountability, follow-up. But pelvic floor strengthening, this is just an adjunct to it. And we have a lot of functional medicine doctors who send us patients, a lot of holistic doctors who send us patients. What is very interesting is I have a world-class pelvic floor PT that I recruited when I was at the Brigham. And when we were evaluating this chair, I sent her the data that was available to see what she thought. And we had a very honest, frank discussion. And she said, well, Neeraj, the success rates are about 60, 70% at 6 months to a year. And I said, yeah. And she said, well, that's not really that great. And I said, well, Rebecca, if you think about it, you sit on a chair, you don't get undressed, there's no risk. And after 6 sessions, 8 sessions, 10 sessions, and you didn't do any follow-up, a success rate of 50, 60% at 6 months and a year is actually pretty good. So I asked her, what do you do? And she said, what do you mean? I said, well, you do. And she said, well, I have them come in for anywhere between 6 and 8 sessions, and then we're done. And I said, okay, and when do you follow them up? And there was silence. And it was an awkward silence. And she goes, well, what do you mean? I said, well, I just told you this chair has a 50 to 60% success rate at 6 months to a year. When do you see your patients? And she sheepishly admitted that she doesn't. So it's very interesting because they don't have follow-up, so they don't know how well they do. And I can tell you right now that many of my patients, they were enthusiastic about physical therapy. Many of them stuck with it and they got good results, but many of them didn't, and they didn't get very good results. So we have found that a lot of patients are referring other patients, their friends and family, for the chair, and word of mouth has become a big deal. On Gwyneth Paltrow's website, Goop, I had a woman come in and she says, I'm here for the chair. And I said, well, how did you hear about the chair? And she said, well, I was on Goop and they had this article that said, superpower your Kegels for a healthy pelvic floor and better sex. And so she came in specifically requesting the chair. And this was 2-3 weeks into us getting the chair. And so, what we've done is we've created a folder where there's a lot of information, both science and a little bit of media hype, which talks about the benefits of the chair. There are celebrities that are promoting this chair. There are doctors that are promoting this chair, but there's still a lot of science talking about it for a variety of conditions and for significant pelvic floor. So what have been our keys to success? And I'd like to share some of those. I think the most important key is proper patient selection. When we have a patient who comes in with stress incontinence, the most important thing we do is obviously a symptomatic evaluation, and then we do bladder testing. And if we have a patient who's having significant incontinence at 100 cc's and it's obvious that it's pretty significant or severe, we don't necessarily adopt the chair as a primary treatment modality. Those patients may be better served with traditional surgery, other techniques or technologies, but we just don't want to set up for failure. What we do think is that there's a lot of opportunity in special groups. So one of the things we do is we offer a patient at a 50% discount to the chair after they have any surgery. We're big believers in referring patients to physical therapy or pelvic floor strengthening after surgery. And so we offer them that for postoperative 50% discount. We have many patients who want to avoid surgery or mesh. We have patients who have mixed or double incontinence, so whether they have overactive bladder and stress incontinence, or they have stress incontinence or fecal incontinence. Postpartum is huge. 25% of all women will have stress incontinence after a delivery, 6 months after a delivery, and many of those patients are a forgotten population. They're told that there's no options or go to physical therapy. And there's a real challenge in doing physical therapy when you have a baby that you're taking care of. And some of our postpartum patients come in with their baby with the stroller. They leave them in the room with them. They sit on the chair, and it's no different than sitting next to your kid at home reading a book. So that really helps. They're in the process of doing some studies about sexual dysfunction. I have a great deal of respect and fondness for Irwin Goldstein, who's probably one of the foremost leaders in sexual dysfunction, and he's in the process of doing some studies, which I think will be very exciting stuff coming down. The pricing is really what you set it at. The company recommends or has found that 6 sessions twice a week, 3 weeks apart, and they charge $1,800. We've changed it a little bit. We actually charge $2,000 and we give them 8 sessions. And we tell them that the protocol is 6 sessions twice a week, but some people need 8 sessions. And if you don't need the 8 sessions, you can bank these sessions and use it as a touch-up treatment down the road. And we find that it's much easier. People don't have to think about whether I need to pay for more. It's a simple number. It's about $250 per session, which is spot on to what our physical therapists charge in the Boston area. So it's comparable to physical therapy, but much more efficient and effective. And I think it's important to develop a follow-up plan. I do think pelvic floor exercises and even a pelvic floor PT referral, which may be covered by insurance so that the patient doesn't feel like it's an added expense to them, or even using pessaries, and then concurrent therapies. So in the interest of time, I'm going to skip through this because I do want to leave. We can cover this during the Q&A session. We have found that in properly selected patients, the therapy is effective and durable. To date, we haven't had a patient who said, I want my money back or I'm not happy with it. Invariably, at the very minimum, all of them have a better awareness of their pelvic floor muscles, much more than even having had physical therapy, and they're better at doing exercises themselves. But again, we're oftentimes using this as an adjunct to surgery to strengthen their muscles to get better long-term relief. We're using it in terms of mild incontinence, and we're using it in conjunction with other treatments as well. So Emsella in your practice, it leverages your own patient population and enhances referral sources. I can guarantee you have a large group of patients currently who would benefit from this already within your own patient population, especially if you're doing obstetrics or gynecologic surgery. It's an ideal adjunct to the pre-existing therapies. It doesn't necessarily have to cannibalize your other treatments or testing. It just augments or enhances them. It's an innovative therapy not widely available. We're starting a postpartum pelvic floor health center starting next year, and one of the keys to that is going to be the Emsella chair. It is a reasonable charge if you really think about in terms of how much you're paying per session, what you're getting, and if you actually divided the cost that they spend per contraction, it's much cheaper than anything that's out there on the market. I think one of the real attractive things about this is there's no recurring or disposable fees, there's no variable costs, and there's minimal staff time required. So Emsella for pelvic floor dysfunction, postpartum depression is 2 times higher in the setting of urinary incontinence. There's a significant correlation between sexual dysfunction and urinary incontinence. Coital incontinence is up to 30% of women with urinary incontinence. And then DI, again, the side effects associated with anticholinergic medication, including the cognitive dysfunction, as well as the dry vagina, especially in the postmenopausal women. There's a lot of benefit to doing a holistic pelvic floor strengthening therapy, and Emsella becomes kind of the cornerstone in that product offering for our patients. Just as an aside, we do a lot of laser, we do a lot of radio frequency, and what I generally tell my patients is the lasers for the mucosa, so it's great for GSM, lichen sclerosis. The radio frequency is for connective tissue, deeper tissues, and then Emsella is actually for the muscles. And we augment that with a little bit of PRP also, where we take advantage of the growth factors. So we use that for overactive bladder, sexual dysfunction, pelvic pain. But many of our patients really are having combination therapy. There are very few patients that say, I'm just getting the Mona Lisa, or I'm just getting the Thermiva or the Emsella. Many of them are combining it so that we can get better outcomes and we can approach it from a multimodal view. So just to wrap up, so I leave some time for questions. I apologize if I ran a little late. There's a growing need for safe and effective treatment options for pelvic floor dysfunction, especially in areas where current options are suboptimal. So many of those special populations, I don't want mesh, I'm in between children. I've tried other things, they haven't worked. I think these are great places where Emsella has a great fit. EM stimulation is not new therapy, but the Emsella and HiFem technology is a novel approach. And I think in the future, with customization and better understanding of these patients. And I think without giving you too much information, they are looking at expanding indications, which will be approved by the FDA, and some new ones may be coming out shortly. So I think that will be even more credibility and credence to the approach. Past data and recent results are encouraging. We've been thrilled with the 70 patients that we've done, and we look forward to 2019 being even more busier with this. But for those of you who want to see long-term data, we do need better designed comparative and sham studies. And the company is currently in the process of rolling out a randomized trial between physical therapy and Emsella chair. And so we're going to be looking forward to looking at those results and then publishing them probably in late 2019. And I think as we see expanding indications, we're going to see a better assessment of the efficacy. And I would encourage you to stay tuned. But for those who are early adopters or feel that this might be a real good fit for their patients, I think it's a great time to jump on this. Thank you very much.